Dr. Nigel Millar is Chief Medical Officer of Health at the Southern DHB. Now, in this interview, he tells us how many men he believes are in a similar position to Steve Hoffman. That is, their lives have probably been shortened as a result of delays to their treatment. But we begin with Steve himself. Was his treatment good enough?
I don't believe it has been. I believe his care has been unreasonably delayed in our system, which I think is, really poor and something we deeply regret.
What has been the impact of that regretful delay on his health?
I understand from the clinical team caring for him that this delays in treatment of this sort is likely to affect prognosis.
And his prognosis is now that his life is considerably shorter than it might otherwise have been.
I don't really want to detail his case over the radio.
Why not? Because he's detailed his case over the radio with us. Is it very convenient for you not to have to confront the issue that as a result of the delay to his treatment?
I'm sorry, John, I wasn't aware that he had detailed his case, and of course I'll take your word for that. You're absolutely right that we are really concerned by the fact that the treatment's delayed, and that sort of thing, delaying your treatment in this circumstance is likely to have an adverse effect on prognosis.
Where does the buck stop for that? Because this is a man who is 62 years old, who is working, who has lost his income, who is incontinent, who now has a shorter life expectancy, who has had a truly miserable time. And his treatment, he was referred by his GP. 10 months later, he finally got treatment. There were so many signs, so many indicators that this man was seriously ill. Where does the buck stop for that?
Well, from my perspective, it stops with the District Health Board and me. I'm the Chief Medical Officer, so I'm responsible for that. I think he may wish to have this formally investigated by the Health and Disability Commissioner, which would be quite a reasonable thing and something I would not want to dissuade him from at all.
No, sorry to interrupt there. We've looked at this before. If it is investigated by the Health and Disability Commissioner, can compensation be recommended?
Technically, the way matters go, and I don't.
The answer is no, isn't it? The answer is no. The Health and Disability Commissioner does not have the power to recommend compensation. In other words,
sorry, John. I was about to explain that in fact the Health and Disability Commissioner can make referral to the Human Rights Commission, where there can be discussions around exemplary damages. That's my understanding. Although I don't believe that's a very common thing at all.
It's not, and that would be the Human Rights Commission making those recommendations around exemplary
That's correct, John.
No, it's not the Health and Disability Commissioner. In other words, where is the buck going to stop at the Southern DHB?
As I said, I'm the responsible senior clinician, so it stops with me. And it's a responsibility of the organisation to make sure that these sorts of things do not happen, that we have good processes and systems of care, and I think in this regard we have severely let Mr. Hoffman down.
How many other people have you severely let down, do you think, in the urology department?
I don't think I can give you a number, but the concerns about this sort of thing is one of the reasons we wanted to have the review, and the review has given us clear evidence of problems in the service through the resourcing and the way things were coordinated or not coordinated. Not coordinated,
yes, that's a nice piece of semantics, and that's the case, isn't it?
I've been totally frank and open with you, John. This is something that really concerns me. Hence the review.
Sorry, I know, and you're here, and we really appreciate it. I'll be totally frank and open with you. Concern is all very well, but if you are dying earlier than you might otherwise die, if you had gone to the public hospital in Dunedin with a reasonable expectation that given that there was a history of prostate cancer in your family, given that you had urinary retention, given that you had a rock-hard prostate, given that you had progressive urinary dysfunction, sorry, that's the same thing again, bladder discomfort, you might have received treatment faster than 10 months later.
I absolutely agree with you. And I think the fact that it's been delayed so long is something that's unacceptable, and we sincerely regret. Sadly, I don't know what I can do to turn that back. except to make sure that now we know about this, we can make sure he gets the best possible care. And we've got the team going through all of the cases in the process to make sure that we're not delaying anyone anymore.
I really appreciate you fronting, and I'm listening to you, and it all sounds right. But this man is seriously unwell. And I'm not a big fan of journalists saying, are you going to resign? I've spent my entire career not asking that question because I think it's glib and it's facile, and actually, you know, usually there are some mitigating factors or some human dimension. But here, the hospital has let this man down so badly, and it seems on the face of it other men down so badly, that I just wonder what has to happen before someone there says, hey, mea culpa, this simply wasn't good enough. I'm going to show you how much this means. I am going to resign.
Yeah, and that's, John, I understand what you're saying. From my perspective, you know, I would resign if I thought it was going to make a difference. If I thought, if I resign, is this going to make things work better and faster and help sort out this type of problem? That's the best I can say, really, John. This really saddens me and makes me feel sick that I am part of the care of a man who's ended up in this situation.
Is there a case for ACC support here? I have a letter from his radiation oncologist saying for the delay in diagnosis, the fact that he had such a high-grade cancer, level 1 evidence to show these tumours progress rapidly if not treated. There is a serious case for this being accident compensation territory.
I think his clinician puts it very well. I agree entirely.
So you support him in that?
Absolutely. I mean, I can't make that decision for ACC. They have to make it, but I think that's been presented very accurately. You know, it's the technical term is treatment injury, which would include significant departures from what is expected timeframes of treatment. In my view, the ACC, of course, has to make a determination.
So the technical term is treatment injury, which is an absolute admission of responsibility by the hospital, isn't it? Because you were doing the treatment.
Yeah, I think we've discussed that already. Okay, absolutely, okay. We are responsible. Yeah.
How many men in the urology department have suffered a similar kind of treatment injury, do you believe?
I don't think I can give you a figure on that. I think it would be inappropriate for me to guess. I'm concerned that there has been significant delays for patients. So at the moment, the first action has to be to go through all the cases and... When you say all the
cases, how many are you talking about? More than 6?
I'm talking about all the people currently in the process of going through assessment, treatment, surgery, etc., which is what has been happening, which the hospital team have been sitting down with the clinicians and going through them to find out who else could be suffering significant delays and what needs to be done to speed up treatment and assessment for patients.
Do you think there are more than 6 patients? Because that's the number we were looking at who had what seemed on the face of it to be really problematic delays. Do you think it is that number? More? What are we talking about?
I think it's very likely there's more.
More than 6?
That's why I feel so, disappointed that we find ourselves in this situation.
More than 6 men who have suffered such delays to their prostate cancer treatment that their life expectancy may be imperiled as a result of it?
There may well be. I can't give you a definite figure, but that's my fear.
Dr. Nigel Millar, who is the Chief Medical Officer of Health at the Southern DHB. More than 6 men. The Southern DHB CEO, Chris Fleming, has confirmed to us there are 6 men in Steve's situation that he knows of. He says there may be many more they don't yet know about. Of the 100 urgent prostate biopsies the DHB is committed to, Mr. Fleming says it expects 25% of those will have a very poor prognosis, meaning their lives may be significantly shortened because of the delays in treatment. So 6 plus a possible 25% more. We invited the Health Minister, Jonathan Coleman, on the program tonight. He declined, but in a statement said, "My sympathies are entirely with the patient and his family. This tragic case illustrates why action has been needed to ensure the urology department at Southern DHB changes the way it operates. This is the human face of the issues highlighted in the independent review of Southern DHB's urology service."